we studied vitamin A, and how far we came? This one, types. This cycle we taught, right? We go to the functions. Now, vitamin A, being a fat-soluble vitamin, it may show up toxicity by two ways. Any fat-soluble vitamin will show up toxicity in two ways. One, due to excess, and one, due to deficiency manifestation. Right? In two ways it can affect our life. Because it can be stored in the liver. So if we take too much of vitamin A, that is not good. So first of all, let us chalk out what happens when vitamin A is deficient. Go through the first lines only. First lines. What is the first line? Night blindness. So, impaired vision. What type of vision? Color vision? No. Dim light vision. What is affected? Dim light vision, right? In the night we have problem, not in daytime. Then, increased susceptibility to infection. Why infection means what? What is related to? Immunity. So, vitamin A deficiency may lead to low immunity. So, it is required for proper immunity of the body. Do we have any such this thing? Proof for that? Yes, if you can recall, during COVID, vitamin A supplementation was given, right, to increase immunity. That is due to increased immunity. Now, this is a effect in the eye only, xerophthalmia, keratinization, abnormal bone development and fetal development. Now, there are three types of vitamin A: retinol, retinal, and retinoic acid. Each one has different function. Retinol has function in maintenance of germinal epithelium and maintenance of normal skin tissue. Derma. Retinal is effective on vision. Retinoic acid, the third part, in tissue differentiation. So, in production of blood tissue formation or in production of WBC, both RBC and WBC. Correct? From zygote to fetal development, retinoic acid is required. Correct? Now, if I ask you, explain that vitamin A can act as a hormone. If you can recall, in last class, I have explained which part? Retinoic acid. So the retinoic acid part acts as a hormone, like a steroid hormone. It can enter the cell and bind to the specific receptor, RAR or RXR. Right? And then they bind a specific region of the DNA. Now all these, so vision, skin, and immunity and germinal epithelium, these 4 points. The skin, what happens in the skin? Skin becomes, in the vitamin A deficiency, skin becomes like a toad skin. It's called Phrynoderma, dry and full of papulas. So it becomes like a rough skin, like toad skin. ব্যাঙের গায়ের যে চামড়া ধুলো মনে হয় শুকনো শুকনো, ওরকম টোট খসখসে রাফ স্কিন পাওয়া যায়, এটাকে বলে ফ্রেনোডার্মা। রাইট? আচ্ছা, ফর আই there is a series of changes. The first change is increased the first sign of vitamin A deficiency is increased, very good, increased dark adaptation period. That means soon after entering the dark cinema hall, the friend, one of your friend who sees last has the highest or longest DAP. Okay? So this DAP will increase. Then, if it is untreated, then what will happen? Xerophthalmia, dryness of the cornea. When dryness persists and the patient is still not taking proper vitamin A supplementation, remember, xerophthalmia may occur in many cases, but most probably in this case, vitamin A deficiency is concerned. So, vitamin A supplement is not given, then right? Keratomalacia means now it has become very dry, thick, and some folds start appearing. Shrinked হয়ে যায়, shrinked হয়ে যায়, ঠিক আছে? Shrink মানে কতগুলো ফোল্ড থাকে, যেমন জামা কাপড়ে যেমন ইয়ে পরে, কি বলে এটাকে, ভাঁজ পরে, ওরকম ভাঁজ হরজাস পড়ে যায়, ঠিক আছে? Keratinization. Now at this stage, if still it is untreated, then it may show early sign of ulceration too. ছোট ছোট ঘা হতে পারে কর্নিয়াতে. From this point, it is it is irreversible. If there is ulceration, then normal vision cannot be regained even after giving supplementation. So it will go up to now at around this stage, through ophthalmoscope, if you see the retina, you will find correct? Now, as a general physician, this condition you can never see, correct? The patient will come mostly with this increased dark adaptation period. They will complain that difficult in studying book after sunset, mostly in the villages. In urban areas, we have tube light, bright light, even though we have vitamin A deficiency, that does not surface up with these symptoms, right? In urban area, we have symptoms like chronic infection, pain in bone deformity, correct? Fracture prone bone, dryness of the skin, these areas, है ना? These areas mostly, dryness of the skin, the areas which come in contact with foreign bodies like these areas for wearing specs, these areas. Now, how far you can supplement? If you give more vitamin A in an anticipation that a patient might not get in future, what will happen? The same symptoms like vitamin A deficiency will appear. There will be deformity in the bone, there will be low immunity, etc., etc. Everything. Skin problem. With hypervitaminosis. Even liver also will get affected. Okay? So here one example is given. Say, during the scientific exploration in the polar region, they met polar bear. This polar bear liver, when a polar bear kills mostly the seals, sea lions, all those things. But the mother polar bear teach the younger polar bear never to eat the liver of the seals. Even the Eskimos, when they kill a polar bear, they don't eat the liver of the seal, a polar bear or seal. Like we eat the liver of the goat, from the mutton or the chicken, they don't eat like that because their liver is full of vitamin A. If you take that much of what the amount of liver we take for mutton or chicken, if they take that much of liver from polar bear, they will suffer from vitamin A toxicity. And many things happen like that. Many of these sailors, they died due to hypervitaminosis A. See, symptoms include dry skin, itching, and bone deformity is also there. It's not there, it's there anyway. And liver dysfunction is also there. Vitamin A deficiency may lead to respiratory disease because it is required for production of and without mucus, the bacteria and the foreign particle may enter through our respiratory system. If mucus is present, it will get trapped there and we will cough it out. Okay? There is no direct involvement of vitamin A in increasing immunity, but it has been seen the people with low immunity, if given vitamin A supplementation, the condition improves. Once it will prevent ensuing infection, but it cannot cure the ongoing infection. Already if you are infected, that will not be cured, but it will prevent further infection. Topical application may be found for acne treatment. Carotenes, mostly their function is as antioxidant. Now, what are the functions of antioxidants? It prevents inflammatory disease. Name one inflammatory disease, CAD. coronary artery disease, name 2, skin cancer or any type of cancer starts from the inflammation. Correct? So atherosclerosis or coronary artery disease, any cancer will be prevented by antioxidant property of certain substances, and that is present in carotenoids. Keratin is available in mostly the colored vegetables, red color, orange color, bright yellow color, bright color, right? Different keratins are different colors. So beta carotene is orange in color. It is found mostly in carrots. So you eat carrot, you get a lot of carotene. You eat too much carrot, your skin becomes carroty. Right? It becomes orange, yellow. Cataract, another disease which occurs due to increased oxidative stress. Cataract, another disease which occurs due to increased oxidative stress. What is that? Give one example. Diabetes mellitus. Cataract due to diabetes mellitus. What happens in diabetes mellitus? Oxidative stress in the lens increases. Okay? Because glucose concentration is increased. Those many glucose cannot be converted to polyol, and polyol is too high in amount because glucose concentration is high. Our lens is incapable of draining that high amount of polyol. It gets accumulated inside the lens, and lens becomes swollen due to increased osmotic pressure, and with the small pores, orifices of the tissue enters the infective organisms which is available everywhere, and it causes infection inside the lens, leading to oxidation of some certain substances which become opaque, and lens become opaque. Hence the cataract appears. So diabetes increases the risk of having cataract. Vitamin A rich food, cod liver oil, shark liver oil, any fish liver oil, mostly sea fish is preferred. Any liver, even the human liver also if available, you can eat, it will contain good amount of vitamin A. You prefer human liver? No? You don't like it? No. Anyway, consider human as just like any other animal, and you can eat it. Because most abundant animal is human after chicken on the earth. Anyway, cannibalism still exists in our society, in our modern society. Recently you found few glimpses of that society. Anyway, it's not a part of those savages anymore. It's a part of our society. We, white collar with good suit, boot, everything. In our society it exists. Cannibalism. Okay. Provitamins, mostly found in your orange vegetables, green leaf vegetables, spinach and all everything. You can write fruits. You remember around 700, this number you remember, 700 microgram, RAE, retinoic acid equivalent, or microgram, either retinoic acid equivalent or microgram, you say RDA. Remember 700, add around 20%, becomes 900 to 1000, 20-25% if you add, that becomes for men. Men, after men comes pregnant and lactating lady. Just add again 200 more. 200 to 300 I say. So it will 900 to 1000. Add 200 to 300, it becomes 1100 to 1200 microgram, and that is the RDA for pregnant and lactating woman. Clear? So 700, 900 to 1000 and 1200 becomes for pregnant and lactating women. Clear? These three you must remember. Either you write this unit or you write microgram. Remember, all fat soluble vitamin we require in microgram amount and water soluble in milligram amount. Mostly, except few. Deficiency of vitamin A, most susceptible population. This particular part is very, very important, this one, because the clinical cases you will get will have few of this point. Either you read all the all the questions, possible questions, which can come in examination, which can be in thousands in number, or you remember or you study the mode of answering type of question. What is the mode of answering that type of question? So if you read the mode, from this you can deduce any answer any question. What you must see in the question, whether it is vitamin A deficiency or not. Is it fat? Is it very fat? Because fat may cause fatty liver, and due to liver dysfunction there will be less absorption of fat soluble vitamin, like in case of obstructive jaundice. Liver disease. Has he suffered from liver disease recently? Is a patient having alcoholic history? Older adults. Why older adults? They have reduced capacity to absorb nutrients. They cannot absorb nutrients from the food, from the diet, like we can. Or, sorry, you can. Me is old man. Urban poor. What is an urban poor? This is very interesting. When I say a very poor man, what picture comes to your mind? Correct? When these poor men become urban poor, what is the difference? They are healthy, but their health lies only here. They are not very thin. These people are urban poor. It shows they are having malnutrition. What they get? They get biryani every day. But is biryani a good food rich in vitamin A? No. No. The footpath dwellers of Kolkata, in certain areas, eat biryani every day. without spending a single penny. But that is the leftover or the excess food from the restaurants nearby. They do not give them the meat portion. Meat portion is kept for reuse next day for us only. They give the only rice, which is full of carbohydrates, with potato, which will get rotten very early, very soon. And the oil they use for making biryanis, the cheap oil is not rich in vitamin A. It is a artificially prepared oil. It is not natural oil anymore. So they are very poor in vitamin A source. So they get a lot of fat, a lot of carbohydrate, less protein. They become very thin. Their hands and legs will be very thin. But fat will get accumulated in the arteries, in the veins, and they will have lack of energy. They cannot work. To become active, we need protein in addition to carbohydrate. But they don't get protein. They get only cheap fat and full of carbohydrate. Anyway, so this is a story of urban poor. And what is this? How many of you used to take, drink a glass of milk every day morning before going to school? Happily? Happily. See, only two. Only two. Rest all, you should ask their mother what all stories they are to make. Today, if you don't drink, tomorrow you can't go taller, then that fellow will become more taller than you, and he will get all sorts of good dresses you won't get. Your hair will become white. Very soon you will become like a dadima if you don't drink milk. Right? Your bones will not be strong. See, you cannot fight. You cannot join judo karate, coaching, all these things. So many stories they used to tell. So due to that, these preschool children, they have very low food value, right? Fat soluble vitamin intake. I think this is already given. Toxicity, when I say a short-term mega dose, 100 times that of the RDA. So what is RDA? How much RDA for normal person? 700. So 100 times means how much? 7 into 10 to the power 4 microgram means how many milligram? 10 to the power 4, 1 milligram is equal to 10 to the power 3, minus 3, তাহলে 10 to the power 3 ভাগ করে দাও কত আসে বলো 10, তাই তো 10 milligram per day, তাই না? If you take, then it is a short term mega dose. Chronic, long-term mega dose. See, bone and muscle pain. I told you, they will come with muscle and bone pain. The symptoms are similar to that of the deficiency of vitamin A in urban cases. Okay, dry skin, hair loss, increased liver size, vomiting, loss of appetite, because liver is compromised, not functioning well, so they cannot digest, they cannot metabolize, so you have this problem, loss of appetite. Does they have teratogenic effect? Keratogenic effect মানে ক্যান্সার হয় কিনা, তাই না? কি পাওয়া গেছে? May occur with as little as 3 times RDA perform preformed vitamin A. কিন্তু এটা ঠিক নয়, ইজ নট কারেক্ট, ইটস নট কারেক্ট, ভেরি রেয়ার কেস, দু একটা কেসে দেখা গেছে, বাট মোস্ট অফ দ্য কেসেস দিস হ্যাভ ডিনাইড। Spontaneous abortion, birth defects. When birth defects occur, it is not only due to vitamin A, there are many other reasons too. Toxicity of carotenoids. What is it there? What is there? Nothing. Patient looks like jaundice patient, but absolutely normal. Nothing is abnormal. The skin becomes yellowish, the urine becomes yellowish, except mucous membrane and sclera. There is a difference between jaundice and hypercarotenemia. What is there? Only the mucous membrane and sclera will not catch color due to carotene. That will catch color only due to bilirubin, hyperbilirubinemia. Okay, that's why we say that always examine the patient for jaundice in the bright sunlight. In the bright sunlight, right? Because in tube light it is not good to understand that difference in the color. And if you have no option, like only tube light is available, suppose you are examining the patient in the night, you cannot ask the patient come in the daytime. You have another option, another tool. What is there? Blood test. You can always ask for a LFT. Huh? Fine. এই দরকার নেই। এই নিউমোনিয়া বললাম, রিজন কি? Mucous membrane producing cells are deficient. So mucous membrane will not be produced. So due to lack of mucus, the inside lining of the lungs will be dry, so it will catch infection very fast. Same thing, when the basement membrane is not regenerating due to absence of vitamin A, what will happen? It will get thickened. So like bladder wall will get thickened. Cystitis means stone formation might take place. Urolithiasis means stone in ureter. Nephrosis means inflammation of nephron. Infection, same thing. Because of lack of vitamin A, it is exposed to infective organisms. Vitamin A has antioxidant property. In absence of antioxidant property, we might get biliary cancer, degradation of Kupffer cells. Kupffer cells, what is the function of Kupffer cells? Scavenging. Good. অবশ্যই দরকার নেই এত। কটা বাজে? আচ্ছা থাক। We'll start vitamin D next week. Next class. Now, vitamin A has come this year extensively. So it's very unlikely that next year you get a long question from vitamin A. But you might get short questions as well. You might get some small clinical correlations as well. Vitamin A is very important because most of the cases when you travel to the rural areas in our country, you find vitamin A having the most deficient vitamin in our country, countryside. So that is why it is very important. Okay, so vitamin A has come this year. So next year, most probably, not any vitamin will come as a long note. Okay, but still, I will teach you the portion of vitamin which are important for short questions. Okay, expect not to have a long question from vitamin A, right? But the other vitamins like vitamin D, vitamin C, they might bring some questions which are clinically correlated from other angle. So that is important. Okay, fine. Any question from vitamin A? Any question? Okay. Try to remember the takeaway points from this chapter is try to remember the sources, RDA, biochemical function, deficiency manifestation, toxicity manifestation, and most importantly, Wald's visual cycle. Wald's visual cycle.